Hi, I'm Dr. Michelle Papka, and this is a presentation on clinical trials for Alzheimer's disease. To begin, it's important to understand how we categorize Alzheimer's disease. Alzheimer's disease is a diagnosis that historically has been made based on clinical symptoms, and more recently, as we have more data and information based on all the research that's been conducted on Alzheimer's disease, we think of it a lot by its neuropathological process. And through this presentation, I will try to define both the clinical syndrome and the neuropathological process and describe how this information has impacted our approach to finding a cure and better medications for Alzheimer's disease. So on this slide, I've listed some of the clinical signs of Alzheimer's disease. Things like memory loss, difficulty with familiar tasks, problems with talking or writing, confusion about time and place, loss of judgment, problems with abstract thinking, misplacing things, changes in mood or behavior, changes in personality, or loss of motivation. So these are just some of the symptoms a person might have, and they may not have all of them, and some of the symptoms may be quite mild. When a person has some of those symptoms, we want to try to figure out what is causing those symptoms, because there are different things that can cause the symptoms. When the symptoms are due to Alzheimer's disease, we are presuming that they're due to plaques and tangles that form in the brain, and these are the neuropathological hallmarks of Alzheimer's disease in particular. So two things start to happen. One is a protein called amyloid starts to clump up in the brain. And when it clumps up in the brain, then it causes this very sticky, gooey substance that sticks between the cells. The other thing that starts to happen is tangles form. And tangles are formed because of something gone awry with a different protein called tau. And once the tangles form, those neurons or cells in the brain are not working properly. So first we have the amyloid plaques, the gooey substance that sticks between cells, and then we have the tangles, which occur within the cells due to a different protein called tau. We know that the third ingredient is neuroinflammation within the brain. The other thing that we know from a lot of research is that the symptoms of Alzheimer's disease, so if memory loss is the first symptom, which is generally the case, we know that these plaques and tangles have been building up for decades before the first symptom appears. And so this is why there is so much research now in terms of clinical trials for Alzheimer's disease geared towards addressing the formation of plaques and the formation of tangles, because if we can stop these plaques and tangles from forming, then we would have a cure for Alzheimer's disease. On this slide, I've listed the currently approved treatments for Alzheimer's disease by the FDA. There basically are two classifications of medications. One are the cholinesterase, and this group of medications help to keep more acetylcholine in the brain by inhibiting an enzyme that breaks it down. And acetylcholine is important for memory functioning. The other classification, the memantine, essentially blocks glutamate from getting into the cell, which causes havoc in the cell when glutamate enters the cell. The two different types of medication work by different mechanisms. And the cholinesterase inhibitors have been FDA approved even for early symptoms of Alzheimer's disease, where memantine is approved for more moderate to severe stages. And a person can be on both medications at the same time because they work by different mechanisms. And that's why more recently there is a combined pill which includes both the donepezil and the memantine. It's not a new medication, but it's a new formulation to help with medication administration. However, while some of these medications may help with some symptoms for some people for some period of time, none of them do anything to stop those plaques and tangles from forming. So none of them are a cure for Alzheimer's disease or a medication which can stop the progression. And this is why clinical trials for Alzheimer's disease are so important, because clinical trials are the pathway to new treatments. And as I've already mentioned, many of the clinical trials that are currently in process are investigating drugs that help get rid of amyloid plaques or stop them from forming, or help get rid of tangles or stop them from forming. Some are addressing anti-inflammatory mechanisms, and others are trying to halt the disease at different stages and pathways. There are many advantages to participating in a clinical trial, and we have another informational video in this library that you can watch to learn more about that. But if you'd like to learn more about enrolling in a clinical trial at the Cognitive and Research Center of New Jersey, please call us at 973-850-4622, or you can access our website at thecrcnj.com. And just know that we are constantly offering different opportunities to participate in clinical trials. And the best way to find out if you could qualify is to give us a call so that we can talk to you more about it. And we thank you for your interest in clinical trials for Alzheimer's disease, and for the possibility of having you join our mission to help discover a cure. Thanks so much for your attention, and call us with any questions.